my name is Stacy Soappman, one of the Aspire faculty members, and I teach the course Manip Like a Girl, Work Smarter, Not Harder. This course is not just for girls. It is for anyone who wants to learn to be more effective and efficient with their manipulations, and or for people who treat patients who are larger than themselves, which on any given day is about 99% of what I treat in the clinic. Over the years, I took a multitude of manipulation courses, and they were great. I learned something from every single course that I took, but I still continued to struggle with thoracic manipulations. It just wasn't working for me the way that I was traditionally taught and the way that a lot of the literature demonstrates the techniques. And so what I'm going to do here is show you some of the problems that I was having and then show you a modification or an adaptation where we can still achieve a successful manipulation technique. However, it doesn't have all of the pitfalls where I was struggling for so many years. So one of the ways that the technique is traditionally taught is the patient clasps behind their neck. Go ahead and put your hands behind your neck. They bring their elbows together, and we have to have them do a curl up while simultaneously reaching around their back to be able to thrust. Right? There's a lot of problems with this technique. One, with their elbows here, I can't get my arm around their body. Two, their face is looking down my shirt. It's right in my chest, which, well, this is my husband, so that's okay. In the clinic, I don't need patients' faces looking right down my chest. I understand why they're trying to create this motion, but we don't have to have it with their face in such close contact to our body. Go ahead and give yourself a hug. Hug yourself like you love yourself. I can still create this same kind of flexion, curl up motion through here with their head being there, and I'm able to stay a little bit more distance from the patient. One of the other pitfalls I was having is that traditionally we have them bend both knees. And when they bend their knees and then they roll towards me, because I'm short, I have them very close to the edge of the bed to be able to reach all the way around the patient and make sure my wrist is flat on the bed. And that's really important to protect your own body during all of these techniques. One of those ways is getting your wrist flat. But by having them so close to the edge of the bed, when they have longer femurs, when they would go to roll, I felt like we were both struggling to not wind up on the floor because the length of their femur, being unsupported, was rolling us both to the floor. So if we have them just straighten the one leg, now to roll off the bed, they have to roll over themselves. So it's just a little bit easier for me to keep my hip here and control their roll. I'm going to demonstrate this adaptation now that I've been doing for the last few years and had a lot of success with. So I've already gone through, safety screened them. They are appropriate for this grade 5 technique. I've obtained their verbal consent, and now I'm going to demonstrate it for you. So I've already done a full examination and found the segment at fault. I've marked it, and I am going to now go in and perform the technique. Find the segment that I had previously marked. I use this kind of grasp. And one of the other things that I found over the years is when I had them just lay on my hand, it really hurt my hands. But if I can put a highlighter or something else in here, it protects my fingers when the weight of both of us comes down on my hand. So I have found my segment. I come in here, I have the patient take a deep breath in, and as they're letting it out, I pull into this motion, I roll them back, my wrist goes flat, there's contact, and right there, we do the high velocity, low amplitude technique at the end of range. We would then, of course, reassess, make sure that we did achieve the desired outcome of improved movement, and then give them exercises to follow up to maintain that extension we were trying to gain. If this excited you and you want to learn more techniques, go ahead and check us out at our website, ASPIREOMT, and look for the upcoming Manip Like a Girl courses. Thank you.